Hi everyone, welcome to week 5. We made it. I'm here today to talk to you about something that I'm very passionate about. As a mom with a 9-year-old who has had 9 surgeries, that has cost me a fortune, healthcare is a very big issue to me. So when I think about his situation and what's going on, and not just my life, but lots of other people's lives, I wonder, why is it that the U.S. is held as one of the greatest countries to live in, but has no form of socialized medicine? Well, that's part of the problem. People keep referring to it as socialized medicine. Behind that expression, the implication is that the system belongs in a communist-run government. Socialized medicine refers to a healthcare system where the hospitals and the doctor's offices are owned by the government, and everybody who works there is also government employees. Universal healthcare is not the same. Universal healthcare refers to a healthcare system where there is a single payer for services, and that payer is the government. The hospitals, the doctor's offices, they all remain privately owned. 40 million Americans on our current system have no type of healthcare coverage. Our system is flawed beyond repair. All people should have the right to quality healthcare, not just the rich. Equal access to healthcare would seem to be a basic human right, but for some reason in this country, it still remains a privilege to only those who can afford it. A single-payer system would cover everyone from birth to death, with no out-of-pocket expenses. This is not the only advantage to single-payer. By 2026, healthcare spending in the U.S. is projected to reach $5.7 trillion. A single-payer system would be more cost-effective. It's estimated that a national health insurance program could save $150 billion in administrative costs alone. Over 25% of healthcare money is spent on billing and marketing. The lower cost estimates assume bigger savings in administrative expenses, as well as lower prices that the federal government would negotiate. Under a single-payer healthcare system, pharmaceutical companies will have to bid on a regular basis to do business with the hospitals. This bidding keeps the prescription drug prices lower. Economic savings would bring benefits to the small business owners and self-employed as well. Those people struggle to bring decent healthcare coverage at an affordable rate. Larger companies also stand to save huge amounts on their spending. Instead of paying a per-employee premium, the business would pay a proportionally smaller tax to the government to offset the cost of the payer coverage. Because the government would take the lead in acting as a single payer for healthcare services, you could then concentrate on running your business. You would not need to expand the time learning the intricacies of the healthcare industry. Healthcare services would be negotiated and paid for by the government. This would give you time to concentrate on your business model and your bottom line. Business owners aren't the only one who would profit from the single-payer insurance. Taxpayers would as well. For most Americans, single-payer would represent a clear improvement over the current system. Patients will be able to access care with minimal financial burdens, allowing patients to afford their treatment. Patients will have free choice to choose their doctor without exception of a network. A person can go from job to job without experiencing interruptions in their healthcare coverage. Physicians would also benefit from the single-payer system as well. Physicians will be relieved from the burden of regulations from private insurance companies, such as pre-approvals and utilization reviews. Patient care will also increase because physicians will be able to make clinical decisions based on their best practices, and patients will actually be able to afford the medication and interventions prescribed to them. Physicians will enjoy simplified billing since there will only be one entity to bill. This will cut administrative costs in-house as well. Less billing means less employees. Overall, a national single-payer healthcare system is the best choice that we, as a nation that considers ourselves civilized, can make to ensure the health and safety of our populace. Single payer will definitely not be perfect. There's still going to be problems within our healthcare system. However, single payer represents an efficient, transparent, and cost-effective way to achieve healthcare. It would provide a level playing field for businesses to compete globally as well. That would be good for business and for us as citizens, and that's the bottom line. I hope that I've helped you to understand why we need the single payer healthcare system, and maybe I changed just one or two of your minds.